Hi, this is Jordan with Barney Insurance. My video today is to walk you through that first step, the basics of enrolling in original Medicare, which would be Part A and B. And again, this is the government portion of what you're signing up for. It's the first step before you can get supplements and or advantage plans in effect. But Part A would be, again, the hospital expenses, and then Part B would be your outpatient or doctor expenses. So you're going to need them both in order to sign up for a supplement or an advantage plan. So as we go through this, we're going to touch on the different topics of, depending on what camp you fall into, what that means for you, and how the enrollment process would look. So the first camp that I want to talk about is to those of you who are currently receiving Social Security benefits, meaning you might have signed up at age 62 to receive benefits before you're Medicare eligible. So if that's you, you will automatically be enrolled into Medicare Part A and B, and you'll receive your cards roughly 3 months in advance before your effective date. Your effective date is always going to be the first of the month of your birthday. So for example, if your birthday is December 19th, your effective date will be December 1st. The small little caveat is if your birthday is on the first of a month, it'll actually be an effective date of the following month. So if December 1st is your birthday, January 1st will be your effective date. The cost is according to 2021, so if you're watching this video after 2021, it could be different, but it's $148.50 a month. And for those of you who already have Social Security benefits, they will take this directly from your Social Security check each month, and you'll pay for it that way. So the next camp would obviously be the opposite of that, those who are not currently receiving Social Security benefits. And this is where we find most of our clients, but most of you will have to enroll manually. And we recommend doing that online. And the reason for that is because the process for the government to get your cards and numbers issued can sometimes be very lengthy, not just weeks, but sometimes even months. And so if we can be more efficient in any step of the process, we want to recommend that. So online usually takes about 15 minutes. And when you go to this link, you'll find yourself here, and they'll even tell you what you need to have beforehand so you're prepared and you know what information you need to use to get started. Second one would be by phone, and this is the Lincoln Social Security office number, which, by the way, don't feel like you have to write all this down. You can just reach out to us directly, because one, we can even walk you through the process ourselves, but two, we could just email you everything you would need to know as far as logging in, and even sharing with you exactly what Part A is and what Part B is and why you're applying for them and things like that. So the other option would be just to go directly to the Social Security office. However, now you really have to set up an appointment to do that. So it's just kind of not a convenient option. And then lastly is mailing in your application to Social Security. If you're signing up for your first initial enrollment, you can do it online. But if you delayed Part B because you're one of the people who maybe has continued to work and have access to a group employer plan that you kept, maybe you enrolled for Part A but you kept your group plan, you actually have to apply for Part B separately and with a paper application. And so I'll show you what that looks like real quick. You would get this, and we can supply it for you, but you would fill this out, and then it would send it into directly to Social Security office. That's pretty simple. As you can see, it's not a very big form you need to fill out. That's simple. But what you need to also include with that right down here in the last section is the employment information. So you'll bring this to your HR department. You'll fill out the first section, they'll fill out the remaining. But the reason for this is if you've delayed your Part B, you do not want to have penalties, and you will have a Part B penalty of 10% per year potentially, that you don't have coverage when you could have or should have had, and you didn't have some other credible coverage. But then also on the Part D, as in drug plans, you could have a 1% per month that you didn't have coverage. So if you went 36 months without a drug plan and you didn't have any other group employer plan that was credible, you could be charged later on when you do decide to sign up. And so this form is what you'll use, and it even gives instructions on exactly how to do it. You'll bring it to your Social Security office, and then they'll get you enrolled and make sure that you don't find yourself in a penalty situation. So also, if you do sign up this way, you're probably or possibly going to be delaying your Social Security even longer when you turn 65. If that's the case, you will pay it by check, and when they do that, This part here, you'll receive your Part B bill in a quarterly statement. So you might be shocked if you're thinking it's $148.50. The first bill is going to be 3 times that, but then they'll bill you each quarter. Most people pay the base rate of $148.50, but there are income-related adjustments. And so if someone's making more money, they might pay a little bit more in the average premium. But they always go off of the 2 years prior taxes. So for 2022 policies, you're going to pay based on your 2020 taxes. And then so if you retire at some point, then it's going to catch up and then it'll be reduced later on. So if you have any other questions, please, again, just reach out to us. We're here to help you, here to walk you through the process and answer any questions. We want to make Medicare simple, and if we can do that for you, we did our job. So thanks again for watching. We look forward to talking to you soon. Bye-bye.